There are many types of hepatitis according to the cause. The first is a viral infection, which is the most widespread, followed by a type of inflammation caused by toxic substances, such as alcohol, some types of drugs, and finally hepatitis caused by autoimmune diseases. Hepatitis, a Hepatitis A, is an easy disease to treat if it is detected early, and once treated, the body acquires immunity that immunizes it from reinfection with the virus, and a vaccine against the virus that causes it is available to prevent it. The virus that causes Hepatitis A is present in the feces of infected people, so it is transmitted to others in the following ways: drinking water contaminated with the feces of the infected, eating foods contaminated with the feces of the infected. Hepatitis type B, Hepatitis B, is one of the types of hepatitis that is cured spontaneously after infection for 2 months in case of infection in adulthood, but in case of infection in childhood, it needs to be treated with antiviral drugs so as not to worsen the condition and reach cirrhosis or liver cancer. The virus that causes hepatitis type B is present in the blood of the infected, so it is transmitted in the following ways: childbirth, in which it is transmitted from the blood of an infected mother to her child; exposure to needles contaminated with the virus. And this condition is frequent among addicts because they do not observe any health preventive measures. Sexual contact. Hepatitis type C. Hepatitis C is known as one of the types of chronic liver infections because it worsens in the body without any noticeable symptoms. Its symptoms are similar to the flu, and the sufferer does not distinguish between them, so the condition often worsens and reaches cirrhosis and liver failure. Hepatitis C can be treated with antiviral drugs for some cases. There is no treatment recommended by health organizations, and there is currently no vaccine for it. The virus that causes hepatitis C is present in the blood of the infected, so its transmission routes are similar to hepatitis B, which was mentioned earlier. Hepatitis D type D. Hepatitis D is an uncommon type of hepatitis because its incidence is limited. The virus that causes it is characterized by its effect on people infected with hepatitis B. It needs the virus B to stay active, and the virus is present in the blood of the infected, so the ways of transmission are similar to the transmission of viral hepatitis B and C. The infection with hepatitis D is certainly associated with hepatitis B, which exposes the body to more serious diseases than either of them, such as cirrhosis of the liver, liver cancer. There is no vaccine against this virus, but hepatitis B virus vaccines do help somewhat to protect against it. Hepatitis E type E hepatitis, A hepatitis, type E, is one of the types of hepatitis spread all over the world, and there are 4 genotypes of it, of which 2 types were found in humans and 2 in animals. Type E has been characterized as causing a serious illness known as acute hepatitis leading to death for some sufferers. The virus that causes hepatitis type E is found in the feces of the infected, so the ways of its transmission are as follows: drink water contaminated with the feces of the infected, eating foods contaminated with the feces of the infected. This virus can be cured by itself 2 to 6 weeks after infection. There is no main treatment for hepatitis E. Some cases are treated with antiviral drugs. China has created a vaccine for the virus, but its use was limited within the country, and it was not distributed to other countries. Alcoholic hepatitis is a type of hepatitis caused by bad lifestyles. It is caused by drinking large amounts of alcohol over many years, as when alcohol passes through the digestive process, toxic chemicals are produced that lead to the destruction of liver cells. Autoimmune hepatitis is one of the types of hepatitis caused by the immune system attacking liver cells, and the disease needs constant follow-up throughout life. And its symptoms range from mild to severe, the most prominent of which are lack of appetite and weight loss, nausea and vomiting, abdominal pain, skin rashes, the appearance of acne, yellowing of the epidermis, enlarged spleen, pain in the joints, and there is no basic treatment for hepatitis C. Treatment is limited to relieving symptoms and controlling the liver to prevent cirrhosis. Many people may not experience any symptoms of hepatitis, especially those with chronic cases of inflammation, such as hepatitis B or C, and if symptoms develop, they often appear after a period of 2 weeks to 6 months depending on the type of infection. Acute symptoms of hepatitis include tired and exhausted, fever, loss of appetite and weight loss, muscle or joint pain, nausea and vomiting, abdominal pain. The color of the stool is pale. The urine comes out dark in color. Jaundice, itchy skin, a general feeling of body disease. Chronic symptoms of hepatitis develop as a result of continuous damage to the liver, which results in the development of some serious complications over time, as chronic symptoms of hepatitis may include the following. Jaundice. This term includes a number of symptoms, such as yellowing of the skin and whites of the eyes, the appearance of dark-colored urine, itchy skin, urticaria, and others. Swelling of the lower extremities, confusion, the appearance of blood in the stool, or liver function test. The liver function test uses a blood sample that is examined in a laboratory to detect signs of liver damage, as some compounds and enzymes produced by the liver reach the blood as a result of damage to liver cells, which can be detected by this test. Antibody testing. The human body's immune system produces antibodies known as immunoglobulins as a response to foreign bodies. There are tests for the detection of immunoglobulins M and immunoglobulins E for hepatitis viruses, type A, B, C. What is known as immunoglobulins to fight infection, where a special immunoglobulin M is produced for each type of virus, and the body also produces at the end of the infection what is known as immunoglobulin C, which protects the body in the future from the virus, and also produces immunoglobulin C for each type of virus. Polymerase chain reaction PCR technology can be used to directly measure the amount of viruses in the blood. Although imaging tests cannot detect viral infections of the liver, they help detect changes in the liver as a result of infection with one of the types of inflammation. Abdominal sonography. This examination helps to assess pathologies in the abdominal and liver area, and also helps to detect fluid accumulation in the abdomen that may indicate the development of liver failure. Computed axial tomography scan. This examination helps to detect changes in the size and density of the liver, and may also help to show lumps or early signs of liver cancer. Magnetic resonance imaging. This examination helps to detect pathologies that indicate the presence of a disorder or cancer in the liver. A liver biopsy is a sample taken from liver tissue and examined microscopically to look for any characteristic signs of the disease. The treatment of hepatitis depends on the type the patient has, as the treatment plans for different types of liver infections include hepatitis. In most cases of hepatitis do not require specific treatment, as they are often short-term cases, but it is recommended when infected with it to take enough rest if it causes a lot of fatigue. And it is also recommended to consult a doctor if symptoms such as vomiting or diarrhea develop, to get instructions for dealing with the disease. And effective acute cases of hepatitis B infection do not require specific treatment, but chronic cases of this type are treated with antiviral drugs such as anticavir, telbivudin, and others, in addition to some vital drugs such as interferon alpha-2b and others, and an effective vaccine is available to prevent this type of hepatitis. The duration of treatment of chronic cases of hepatitis B varies depending on the case, as it can last for several months and may reach years, in addition to the need to obtain medical evaluation and examinations to ensure the effectiveness of treatment on an ongoing basis, which makes the material cost of treatment expensive. Antiviral drugs are used to treat both acute and chronic cases of hepatitis C, but people who develop chronic cases of this type are often treated with a combination of antivirals. Drugs used in the treatment of hepatitis C include the drug declotazvir and drug combinations containing the drugs ledipasvir and sofosbuvir, or the drugs grazoprevir and pasvir, among others. There is still no specific antiviral drug used to treat hepatitis D, however. A type of vital medication known as peginterferon alpha-2A may be used in the treatment of chronic cases of this disease, however. Studies indicate its effectiveness only in 25-30 of infected people. Infection with this type of hepatitis can be prevented by receiving the Hepatitis B vaccine. There are currently no specific medications used to treat Hepatitis E, and most cases of this type of infection are acute, short-term, and do not require treatment, as most cases heal on their own. Immunohepatitis is treated with immunosuppressants, which are drugs that suppress or weaken the immune system of an infected person, reducing the activity of the immune system in attacking liver cells. Treatment in most cases depends on the use of corticosteroids, such as prednisone or budesonide, which are considered one of the most important drugs in the treatment of early immunohepatitis, and azathioprine is also used in many cases, whether with or without steroid drugs. Liver transplants may be resorted to in people whose cases of hepatitis develop significantly, leading to serious complications, such as liver failure or cirrhosis of the liver failure.